Good morning, everyone, and welcome to our webinar on IPM performance for the month of September. Thank you very much for joining us today on a Tuesday morning. So what we will be covering today, we are covering very interesting topics today, something which everybody is looking out for. How has the GST impacted the distribution channel? So our first most important topic for the day would be impact of GST announcement on the pharma distribution channel. Then we will go to our regular sections of IPM therapy performance, growth drivers, top 40 corporates, top 40 brands, and the key takeaways on the IPM performance for the month of September. So let us look at how GST has impacted the distribution channel. When I'm talking about the distribution channel, I mean both the retailer channel as well as the stockist channel. Though our focus would be much on the stockist channel because a stockist would buy when a retailer would buy from the stockist. So GST reduction from 18% to 5% created some disturbance in the otherwise smooth pharma distribution system. Usually the way goods get picked up in the pharma distribution system are the entire pattern is quite smooth and predictable on different days of the month. But this GST announcement definitely created some sort of noise and some sort of change in the pattern. Though this reduction in GST announcement has been a boon for the patients because it brings down the cost of the medication significantly, and the disease burden, especially for chronic care patients or chronic patient, comes down significantly because of this GST announcement. This announcement was made somewhere on 3rd September in general. And by then, because the announcement was made on 3rd September, but then before 3rd September, because August closing happened towards the 30th, 31st of the month, a strong pickup had happened with the older GST rate in the month of August. The second half of the year is usually the acute and subchronic therapy season, and more than 50% of the sales in these categories in India happen between July and December. So, typically in India, the market is a strongly acute and subchronic market, while the chronic segment is picking up. And how do we define as acute, subchronic, and chronic? Acute is somewhere where the medication is taken for anywhere between 7 days to 30 days. Subchronic would be somewhere between 1 to 6 months, and chronic would be more than 6 months or lifetime. Hypertensions, antihypertensive products, or diabetes products, they fall in the chronic segment. Now, if you look at typically what I have done is I have looked at the sales value contribution for 2 years. I have taken it for 2023 and 24, and sales in the first half and sales in the second half. Overall IPM, 52% of the sales happens in the second half of the year, whereas for acute and subchronic segment, the second half contributes slightly more than the first half in terms of sales contribution. For chronic, it's almost 50-50% in both the halves. Also, why acute and subchronic section becomes important is collectively, if you see, acute segment contributes to around 45% of the IPM and subchronic around 21. So more than 65% of the contribution to the IPM comes from the acute and subchronic segments. This was essential because many of the goods like anti-infectives, cough and cold preparations, they fall in this segment. Now, when we are looking at the analysis, what is the approach that we have utilized? We have studied the regular distributor purchase and sales pattern on different days of the month. Like on 1st of the month, how much gets purchased. 2nd of the month, how much gets purchased. 3rd, 4th, 5th, how much gets purchased. Then this was superimposed with the sales pattern for the month of September 25. Identification of reasons why certain distributor purchase peaks happen on different days of the month was looked into, because sometimes it may be a normal pattern in which the sales happen, and that pattern may have got disturbed in the month of September. Correlating the same with market behavior to understand why the same did not get replicated in the month of September. Then, as we had to do a comparison of daily sales, we used the indexing or the multiplier method. So I will just, with some examples, we will explain to you how we have done this indexing or the multiplier method. And with this method, what do we do is we put the sales on the first day of the month as a base, and against the sales of the first day of the month, how did the other days of the month behave? Now, this is a simple example. So, the sales on the first of the month is considered as, we consider that as a base, and whatever happened on the second day, we just divided it by the first day. So, on the second day, almost 1.4 times of sales happened. Third day, almost the same. Fourth, 1.3 times. Fifth, probably little lesser as compared to what happened on the first day. So the purchase value and sales value is compared. Obviously, because already a lot has been purchased at the time of the closing on the 30th or 31st of the month, this multiplier will be relatively lesser in the initial days of the month. Also, depending upon when the first of the month falls, the indexing base day will change from month to month, as we will not be considering the first of the month as the base if the day is a Sunday, because very few transactions happen on Sunday. So if the first of the month is Sunday, then we consider second day of the month as the day for the base. Now this is just for explaining. So as we look at actual sales for the month of August and September, the picture becomes clearer. Now we look at the distributor purchase and sales trend. What distributor purchased and how much he sold in the month of August. This was before any GST announcement was made. So typically, if you see the blue color line, this one is the purchase value and the sales line. This is the sales value. Now here I am not putting the purchase value or sales value. This graph is about the multiplier over day one of the month. So this is not the exact value that we are talking about. So typically we have this into A, B, C, D. We see four peaks. So what is peak A? So if you see, this is almost 5 times of what sales happened on the day one, which was not a Sunday. So after a strong purchase at the end of the previous month, the stockist has sufficient goods for the first 15 days. Then as the stocks liquidate, there is a need for the second purchase, which happens somewhere in the middle of the month. This is the reason why we see a slight peak in the around mid month. Then we look at peaks B and C. Why do these peaks occur? Some of the major Indian pharma players and multinationals have their monthly closing between 28 to 27 because bigger companies, majority of them and multinational, prefer not to have the last minute rush on 30th or 31st as their sales closing. So many of them close post 20th of the month. And the last one is all the rest of the companies have their closing on the last day of the month. Thus, this is a typical pattern, sales pattern, which is seen, whether it is the distributor purchase or the distributor sales value. You will see peaks happening over here, whereas this second line, the orange line that I am seeing, is the sales value, what the distributor has sold from his side to the retailer. This trend line will be relatively steady because this is more of a secondary sales which is demand based and the retailer will buy when the demand is higher. The indexing numbers may deviate slightly from month to month depending upon the seasonality pattern or certain bonus schemes announced. It will change, but more or less this is a standard pattern which people see. The peak may not be 5.1, it may become 6, it may become 4, or the peak instead of coming in this time of the month, it may come in this time of the month, depending upon what is the month and what is the disease season for the month. Then we look at the month of September. How does this pattern look for the month of September? So in the earlier graph, this was somewhere around 5, this was 7, 7, and this was around 23. But if you look for the month of September, the peaks for the month of September are subdued as compared to the ones in the month of August. Now, why this has happened is initially in the mid month, there was a little confusion among the retailers on how the GST benefits that would have to be passed on to the consumers would impact them because you were not supposed to change the price on the strip, but you had to pass on the benefit to the patient. Many of them followed a wait and watch strategy, waiting for what notification comes from the companies regarding this GST that had been paid. Would they get an extra credit period, credit note? They waited for that. Then these peaks B and C, which are usually the closing times for bigger pharma companies or multinationals, we did see some amount of peaks, but these peaks again were subdued as compared to the normal months as the stock purchase happened only for the goods that were needed urgently and there was a genuine shortfall. And if you see the D, there was some communication that was sent from the pharma companies to the distribution chain on credit notes and periods in relation to the GST implication. So that's the reason why last month the sales did move up. But then if I were to look at the surge in terms of and comparing August to September, this is the purchase trend. The blue line shows for the month of August, this is how the purchase happened. And this one, the pinkish or the purplish line, shows how the sales happened in the month of September. So if you see, the peaks were quite prominent in the month of August, but then they were subdued in the month of September. Similar trend we have seen even as far the sales trend, the sales which happens from the stockist to the retailer. If you see the blue line, the sales was relatively higher in the month of August as compared to what happened in the month of September. Also, if you see the last day pickup, which happens in the month of, on the last day of the month. So for the month of September, we had 30 days, and for the month of August, we had 31 days. So the peak was significantly stronger for the month of August as compared to what we see for the month of September. This essentially can also say that the communication from the industry to the distribution chain has been passed on, a stronger and clearer percolation may take some more time in order to enable the normal seasonal and demand based purchase of goods. Again, everywhere we have not put the sales value, we have put the indexing or the multiplier. If you look, why I have purposely kept the scales same 0 to 25 and 0 to 25, because when I'm putting similarity or same scales on both the graphs, it actually gives me a good comparison of the purchase versus sales that has happened in the market, and comparing it for the last 2 months, August and September. So if I were to summarize this impact, reduction in GST has been a welcome move for the consumers as it significantly reduces the cost burden of the disease, especially the chronic care patients. A slight disturbance seen in the pharma distribution channel in the month of September 25. It is expected that the communication to the retailer on how it would not inadvertently impact their business due to some strategic plans from pharma industry, it would percolate better probably in a month's time, probably one more month needed for things to stabilize. And this would need to normalizing of the monthly purchase and sales trend at the distributor level as well as the retailer level. So this was about the impact of GST announcement on the pharma distribution channel. Now, next section, we move to the IPM therapy performance. If you look at the IPM therapy performance for the month of September, the IPM has shown a healthy growth of close to 7.3%. While overall IPM has shown a growth of 7.3%, there are therapies like cardiac, diabetes, respiratory, antineoplastics, urology, and vaccines which have managed to show a double-digit growth in terms of value. And also, if you look at the unit growth of these categories, that unit growth has been also relatively robust. As far as antineoplastics is concerned, it's mainly the MABs which are driving the growth in terms of value as well as units. Then coming to the growth drivers, if you see for the month of September, the growth is mainly new introductions and price driven. Volume growth slightly negative or stagnated. But then this volume degrowth is much lesser than what was seen in month of September 24 or same time last year. If you look at when I'm talking about volume growth as negative or stagnated, which are the therapies which are bringing down the volume growth? It is the gastro, the nutritionist, the pain, the derma, and the blood related and the ophthal segments among the top, which are bringing down the volume growth of the IPM. Coming to the top 40 corporates, while the overall IPM has grown by close to 7.3%, there are certain players like Intas, Torrent, Zydus, DRL, Macleods, Glenmark, and USV. All of them are showing a robust double-digit value growth. And a good number of these players are also showing a healthy unit growth. Coming to the next players ranked 21 to 40, Ajanta, Laranon, Corona, Hetero, Nutricia. These are the companies which are showing a very good double digit value growth, and in terms of unit growth as well, these companies are on the positive track. Their unit growth is much better than the IPM's unit growth. So unit growth being positive also is a very strong indicator that it's not just price that is pushing the growth. Now coming to the top brands in the IPM, if you look at a MAT level, GSK and USV, Augmentin and Glycomet GP maintain their number one and number two position. Mixtard, Thyronorm, Deolin, Telma, Silacar, these brands show a healthy double-digit value as well as unit growth. While we see all the brands ranked from 1 to 20, what we are seeing is rank 2 brand is missing in this chart. So Mounjaro from Eli Lilly with rupees 80 crore turnover for the month of September becomes the number 2 brand in the IPM for the month of September. This brand was launched in March 25 and the brand has garnered a cumulative revenue of close to 233 crores till September 25. So Mounjaro would be somewhere lying over here. Number 1 brand for the month is GSK with 85 crores and Mounjaro followed by that rupees 80 crores. Number 3 brand Pan with 77 crores revenue. Coming to the next set of brands, Budacort, Lantus, Brillinta, Ditor. Among the next set of brands from 21 to 40, these are the brands which are showing a significant and a very strong double digit value as well as unit growths. So if I were to summarize the IPM performance for the month of September, the IPM has shown a value growth of 7.3% with all the therapies showing a positive growth. New introductions and price growth have driven the market growth for the month of September. Majority of the top players have shown a very encouraging value growth, and Augmentin and Glycomed GP continue to retain their leadership position at MAT level. Also, interestingly, Mounjaro becomes the number 2 brand in the IPM for the month of September. That's all for in terms of our analysis of the IPM for the month of September. Your feedback on the sessions is welcome, and thank you very much for joining us today. Have a great week ahead. Thank you so much.